Today we'll provide education to Mr. Spitzer. Mr. Spitzer is a 55-year-old male who holds an accounting degree and works for a local accounting firm. He was admitted yesterday in acute exacerbation of COPD. He's scheduled to go home tomorrow. This morning I'll provide education on albuterol aerosol therapy. Good morning, Mr. Spitzer. How are you?
Fine, thank you.
Okay, good. Well, this morning we're going to talk about, or actually I heard you're going home tomorrow. I want to make sure that you understand all your medications before you go home. And this morning we'll talk about albuterol, one of the inhalers that you're going to be going home on. Okay? Alrighty. So we'll have a short education session today, and hopefully after you learn more about albuterol and you take it correctly, you'll have less episodes of shortness of breath, as well as, and when you do have episodes of shortness of breath, it will help you ease your breathing so you can breathe more freely. After our session this morning, I'm hoping that you'll be able to identify some of the abnormalities that are going on in your respiratory system with you having COPD. Additionally, describe the effects the albuterol is having on your respiratory system when you take it and how it works. And also, when should you use albuterol? I'd like you to know when it's time to use it, and also to be able to list 2 side effects of albuterol. Does that sound doable to you?
Sure.
Okay. All right. So tell me a little bit about what happened to you before you came to the hospital. What brought you to the hospital?
Well, I was at work, and I guess I was having some anxiety, and I just couldn't breathe and kind of panicked and went to the hospital.
Okay. How did that make you feel when you couldn't breathe?
I felt like I was suffocating.
That's pretty scary. Listen, what did you do to help make yourself feel better?
I just tried to relax, and just nothing seemed to work.
Okay. So you came to the hospital. That's always a good thing to do. All right. So I'm going to talk to you about albuterol, but it's always important to know how the medications are working. And I also want you to know what's going on in your respiratory system when you have COPD. So COPD actually is a combination of 2 different disorders. It's chronic bronchitis and emphysema. And together, this is causing your breathing problems. Okay, let's look at the bronchitis first. First, let's take a look at your normal breathing system. The bronchitis affects your tube to help your breathing. And then with bronchitis, it causes an inflammation of this tube. It causes it to narrow. The inflammation, there's also some irritation there, and the irritation causes more mucus production, which makes it harder for you to breathe in and breathe out. And then the emphysema affects your bronchioles right over here. Excuse me, that affects your alveoli, or the air sacs. And the air sacs usually are nice, round, and plump. What would happen with emphysema, they become very flabby and overextended, kind of like an overextended balloon. So together those 2 disorders are making you short of breath. COPD, the medicine you're taking is going to help relieve your symptoms, but it's not going to reverse the disease. Okay, so the medication again today is a bronchodilator, which means it's going to open those little bitty bronchioles. As we saw, they were very narrow due to the inflammation and irritation, but it's going to open those up, allowing you to breathe easier. There are several different kinds of bronchodilators, but the albuterol is a rapid-acting bronchodilator, which means it works very quickly. It's also sometimes called the rescue inhaler because it's going to rescue you whenever you're having trouble with your breathing. So when do you use it? You're going to use it whenever you feel extremely short of breath and you can't catch your wind. It's when you're going to use your albuterol inhaler. Similar to when you came into the hospital. That's when you would have used your that's when you'd use your albuterol. Over here you can see how albuterol works in this little picture here. You see that this diseased, or this bronchiole is very constricted, very tight. The muscles are squeezing around it. And then when the inhaler is taken, these little green spots here, it's going to be absorbed into your body. It's going to absorb into your respiratory system, and it causes a relaxation of these muscles, decreasing of the inflammation, so it allows for you to breathe easier. Again, it works within minutes, and it's going to last for about 4 to 6 hours when you do take it. There are some side effects with the albuterol. One of them is very commonly is feeling tremors or kind of nervous when you take it. Again, usually your body will get used to this, but just wanted you to be aware of that. You also may have some trouble with hoarseness or pharyngitis. Some of the patients Especially when you're short of breath, you want to hurry and take a quick deep breath in with your inhaler. And what happens is that the medication deposits in the back of your throat, sometimes on your vocal cords, causing the hoarseness or pharyngitis. It's important to take a slow, deep breath in whenever you are taking your albuterol inhaler. Some other symptoms that may occur are a fast heart rate, maybe sometimes a nosebleed, loss of appetite, or some nausea. Very rarely, but does it happen, maybe additional wheezing or shortness of breath may occur. Again, it's very rare. We don't anticipate that with you, but I do want you to be aware of that. You are also on a diuretic called Lasix. And whenever Lasix and albuterol are given together, it may cause your potassium to be down, to drop down. So your doctor was going to be monitoring your potassium to make sure that it's not going to be too low. You may also want to increase some potassium-rich foods like maybe bananas or oranges, something like that, to help you keep your potassium stable. A food you may want to avoid is caffeine. Caffeine may cause you to feel jittery. Similar to the picture that you have right here, the guy probably had 12 cups of coffee, and in combination with albuterol is not a good idea. Again, it could cause added jitteriness. Some lifestyle environmental changes, again, I mentioned the caffeine to avoid that, but you also want to keep a log or a record of every time you take your albuterol rescue inhaler. And also note anything that you think might be triggering or causing you to use your inhaler more frequently. Perhaps it might be stress at work, or it could be some pollens, increased pollens in the air, your allergies are acting up. Any of those things could be a trigger to you having to use your rescue inhaler. You also want to be sure, and if you're using it more frequently, several times a day, be sure and let your doctor know. He may be able to adjust some of your medications, and that will prevent you from using your rescue inhaler so frequently. Lastly, you want to be sure to notify your doctor of any chest pain. Also, if you feel like your heart rate is rapid, about to pound out of your chest, and it's not going away, be sure and let your doctor know about that. Do you have any questions? This has been a rapid session. Any questions for me? No? Okay, well, I have a few questions for you. So what changes in your respiratory system are causing you to be short of breath?
Well, the air passages are narrowing, and the air can't get through.
Okay, very good. So when's it necessary to take your albuterol inhaler?
In case of emergency, when I can't breathe.
There you go. How does albuterol help you?
It relaxes those muscles and allows for that air to pass through for you to get your breath.
Okay, good. Can you tell me 2 side effects of albuterol?
Feeling jittery, like having a bunch of coffee, or heart racing.
Okay, very good. Can you think of any questions right now?
No.
Okay. Do you think the session's been helpful for you?
Yes.
Okay, good. Well, I'll be back around 9 o'clock, and we'll go over the proper way to take your albuterol inhaler. Okay? Thank you.